So for the liver, first of all, let's see what the liver is. So if this is your abdominal wall and the diaphragm is here, your liver sits here like that. And then he has what we call hepatic artery supplying blood to the kidney, to the liver. We have the portal vein, which is a big vein, retaining all the blood from the GI tract. So this is portal vein to the liver. These veins join together to form inferior vena cava, together with the other veins to retain blood to the heart. So as you can see, the liver is a vascular organ. What does that mean? That means tons of blood everywhere going to the liver. So anything you do to the liver, basically you're putting a needle through a structure that contains a lot of blood vessels, and they can bleed. Liver can bleed if you puncture it. And therefore, based on that pathophysiology, what do you think? Well, if a patient is going to have a liver biopsy, what should we want to prevent? Well, we want to prevent bleeding. So we want to avoid anything that will cause the liver to bleed. Usually, you want them to avoid taking NSAIDs. NSAID cause bleeding. So they need to stop NSAID at least a few days. Like aspirin, if they're on aspirin, well, 7 days, they should stop taking aspirin for 7 days. They should avoid taking any Coumadin. So they need to stop this at least 5 days. If they take any anticoagulation, so any anticoagulation, you know them, Lovenols, all the agatobands and the new factor 10 inhibitors, the indirect, and direct factor 10 inhibitors, they need to hold all of them. They all have their half-life. Some of them, they got to stop it for 2 days, like a PCBAM, which is a factor 10 inhibitor. They need to stop 2 days before the procedure. So you got to give them precautions to avoid all of them. Of course, what would you want to do as a nurse if the patient is in the hospital? Well, check their INR and make sure it's not too high. Check their PT, make sure it's not too high. And check their PTT and make sure it's not too high. And check their platelets. If their platelet is less than 150,000, so 150K, well, that's thrombocytopenia. They're going to bleed. So these are pre-procedure precautions. Questions, they can be SATA questions, or the next gen, it can be multiple SATA. Basically, you can have to select, you got to know as you educate the patient or as you prepare for the procedure, and then they can have multiple questions in the next gen. So this is the same thing. If you know it, no matter how they set the question, how they present it, where you have to select a box or anything like that, it's the same thing. So pre-procedure, you tell them all these things. And what do they do with the procedure? Well, the liver is on the right upper quadrant. So they lay on their back, and then so they will lay on their back, and the biopsy, and their hand will be above their head, and they do the biopsy and at the right upper quadrant, and then they take whatever biopsy. Usually they're looking for the tissue to make diagnosis. So they go here, take a little bit of the liver tissue, and then they done. So that's the pre-procedure. Of course, this is not an emergency procedure. So what do you think if patient is not undergoing elective procedure and there's no emergency, patient can consent? Well, you need to have an informed consent. Of course, you don't obtain the consent. You make sure that the consent is obtained by the provider. But you make sure there is a consent and you sign. What I mean is you witness the consent. Patient sign the consent after being canceled by the doctor, and then you witness the consent. So these are the things you need pre-procedure. And after they remove the procedure, then what do you do? So post-procedure, what are the things you need to know? We're dealing with a vascular organ. And what we did pre-procedure is to prevent them from bleeding post-procedure. Therefore, at the end of the procedure, what do you look for? Well, post-op, you should be looking for things that will cause the patient to bleed. Signs of bleeding. So you're looking for signs of bleeding. So monitor the patient for bleeding or hemorrhage. And then how do you do that? Well, there's a way you have to check their virus. You got to prevent shock. And shock will present with what? Increase in heart rate, decrease in blood pressure, decrease in urine output, and a acute change in mental status. So all these things, you have to be watching for bleeding. And so in order to know this, you got to check, you assess their vitals. So assess their vitals. Vitals. This is not the patient that you check vitals every 4 hours. What you do is the first 1 hour, you check their vitals 15 minutes. So you end up checking a Q 15 minutes the first 1 hour. So you check it 4 times. The second hour, you check it for 30 minutes. So Q30, the next 2 hours. Then after that, you check it every 4 hours. So the first hour, every 15 minutes. So you check it 4 times here. The second hour, you check it every 30 minutes. So you check it twice here. And then every 4 hours. The key thing is, to prevent bleeding. We stick the liver, we put a needle through the liver, and we want to prevent hemorrhage. So your board examiner, initially when you do the procedure, you let them lay on their back. But after the procedure, the examiner wants you to know how to prevent bleeding. So they will ask you questions. You need to know that now you need to put pressure on the liver because the liver is inside, you can't put pressure on it. What you can do is you can press the liver on the rib cage. If you put your hand on your right side, you can see the ribs go all the way down where the diaphragm is. So the rib can act as a tamponade to put pressure on it. So you put this patient on where you did the puncture. So patient should be placed on the right side. So they lay, because the liver is on the right, so they lay on the right side, or they will say on the affected side, or where you did the procedure. So place them there on the affected side. What is going to happen? They have to lay on that side for 4 hours. So lay on the affected side for how long? 4 hours. They have to still lay on the bed. So lie in the bed. So you can say bed rest for at least 12 hours. So they will be in bed for 12 hours. but 4 of those hours they lay on the affected side. So they lay on the affected side for 4 hours. Then after that, they can stay on their back for the next 8 hours to a total of 12 hours to prevent bleeding. So at least 12 hours bed rest. And so you expect that this will be like a certain form of question. And then because we're looking for hemorrhage, when they give you a prioritization question, if somebody have a liver biopsy and you walk in and they lay on their back, you know that this is absolutely wrong. This is wrong. Patient is going to be bleeding. So this is the one they can ask you intervention. I need to intervene for this patient who had liver biopsy, is laying on his back. I got to intervene right away. So that is wrong. They have to lay on the affected side. Somebody have a liver biopsy, his blood pressure is 90 or 80. I need to intervene, call the doctor. That's a priority. Somebody with liver biopsy, his heart rate is 120. I need to call the doctor. Somebody with liver biopsy, his urine output is 30 for the last 4 hours. I need to call the doctor. Somebody with liver biopsy with change in mental status, I need to call the doctor. All of them is in B sharp. It's a shock phenomenon. Somebody with liver biopsy with ecchymosis in the belly button umbilicus, I need to call the doctor. Somebody with liver biopsy with Gray Turner syndrome, no, Gray Turner sign, that means bleeding in the frank area, retroperitoneal bleeding, I need to call the doctor. You see what I'm doing? I'm giving you signs and symptoms, prioritization, patient that you need to call the doctor right away. These are the way they're going to present those questions. So liver biopsy, with all those things, I need to see them first. Liver biopsy, laying you on the back, I need to intervene. These are the preoperative things you need to do and before the procedure. So that's all you need to know for liver biopsy. It's very important and it's straightforward.